Cathy, grab a seat. It's lovely to see you. And hi, Cathy. Cathy, you're a wound care specialist in Christchurch, and you're also about a centimetre away from becoming a nurse practitioner in your own right. Yes. And I had the privilege of going to your workshop this morning, and it was just wonderful. I think probably the top thing which I think us rural GPs need to know is, as regards wound care, what are we doing wrong? You receive referrals from all over the place, and you must cringe and think, oh my God, what are they doing? So what makes you cringe? What makes you think, oh, these guys ever qualify?
I think the thing that I get most concerned about is how other health professionals will hang on to patients. So I think there is something in all of us that we really want to do our best, and we think that we can actually heal a wound. The body heals the wound, not us. But and so
we can stop it though, I think.
We can, yeah. But I think what happens is, we'll have patients coming in with they've had a wound for like 2 years, and different nurses and doctors have been trying to heal it, but actually they really need to be referred to a specialist unit. So I think the whole thing is the wounds should go on to heal. If they're not healing within 4 weeks, they need to be referred to specialist unit. And the idea of the specialist unit is that they can then do a holistic assessment, see what needs to happen, and then put a plan in place and send them either back to district nurses, to general practice, wherever they need to be.
That's superb. And in fact, there's lots of different therapies we want, and I'm just curious. I think a lot of practitioners are into their own way of doing things. People enjoy alternative medicine, and there are some wacky therapies out there. Some work, some won't. So what wacky therapies don't work? What should we stop doing? What has gone out of date and we shouldn't do?
Oh, right. Certainly, some of the things that we still see, which we really don't want to do, is drying wounds out. There is still a lot of practitioners who think that it's really good to dry the wound in the sun. What happens is the way that the wound heals is it needs to be a moist environment for the cells to move. So drying it out not only will stop the wound healing, but will cause a lot of pain.
Fair point.
So yeah, really important to change that.
And one of the things which made, I think, everybody curl a little bit, and you brought them with you, is larval therapy,
yes.
which
yes.
This is where Joe gets particularly interested. So could you like to tell us a bit about the larval therapy? I think hitherto known as, well, maggots. Go for it.
Yes, it's been around, certainly the Napoleonic Wars they were using it, but it's really come back into its own. Using sterile maggots, they're not sort of the general ones that, we don't want flies just laying eggs on a wound. So we get sterile maggots ordered from, there's one place in New Zealand, in Hutt, and then what we'll do is we'll put those onto the wound, leave them for 2 to 3 days. They will then eat the necrotic tissue. They won't touch any good tissue. So they will eat that away, and then we can just wash them off. Sometimes we have to repeat that several times, but what it does is then you just get the new healthy tissue that can grow. So times that it can be really useful to use this is patients, instead of having like you might need to send them off to plastic surgeon to have a wound debrided, well, it would be really nice to be able to do that in the community straight away. Sometimes patients might find sharp debridement really uncomfortable. So again, this can be a much more comfortable, pleasant way for patients to have it. And I think it's interesting how you said, sort of like, ooh, it's funny, a lot of patients ask to have it done, and the people who are having a problem with it is not the patients, it tends to be the health professionals.
Oh, I can imagine. I think we've even got a video clip to curl our toes a little bit coming up because they're very small in there, aren't they?
Yes, they're very, very tiny.
You said about we'll never see it on screen, but I think, did you show a video at your session this morning where they grow into slightly larger animals, really, don't they?
They grow much. Yeah, I'm not sure if it's coming up or not.
Oh no, well, that's a good-looking person there talking to us. So
but they come.
We'll see it on video in a very short while.
They're going to show it, yeah.
Now then, just that, and I'm pleased we've got Joe here because I'm sure this.
I'm not sure that I'm quite pleased to be here. Actually,
essentially, we eat them at the end of the presentation here. But all jokes aside, part of the problem with certainly rural remote medicine is access to care, and oh look, here we are. We've got oh look at this.
The necrotic tissue and the slough. So you can see how big they grow after just 24 hours. These are 24 hours old, and they're very active, as you can see.
The tyranny of time and distance has been something which has haunted us all. So for rural and remote communities, can the Rural Health Alliance help us access better wound care by getting more integration and defragmentation of our services? I'd love to hear you two talk to each other on, can we improve one particular thing, wound care, by virtue of this Rural Health Alliance?
I think that would be a real challenge. I think the key things that we identified yesterday were things we didn't really talk about wound care, but the key things we talked about were things like the loss of a rural bus service and I suppose the resulting crash that might end up with, you've got a 70-seater, 30-seater bus with 70 kids on it now. Would result in several wounds that might need some long-term care. But is there a problem with access for people from rural communities to those specialist services?
I think we're doing a lot of work to try and solve that. Certainly in Canterbury we're doing work with some of the rural practices like Kaikoura. So we have, every 6 months we have a specialist clinic where myself and a vascular surgeon go out, meet with the nurses and the doctors, give education and have a clinic. So we're seeing patients, but a lot of what we're trying to do as well is to bring up the knowledge base of the nurses and the doctors.
Yeah. Is there anything particular about this larval therapy that would be why it would have to be applied by a specialist nurse in a specialist centre?
No. I think it's around making sure people have the access to the education,
Yes.
knowing who to use it on, when to use it, how to actually, if you need further advice, how to get in contact with the specialist who can actually just talk to you on the phone.
Yes.
Or but then you can order it. They come by plane. So they can be flown, they can be couriered, they'll come to your door, you can put them on, and so the patient can have them in their own home.
So where the Rural General Practice Network might fit with that is providing opportunities for education, and with the Rural Health Alliance, it would be around, because I'm surprised that you say that the patients are asking for this and that it's the health professionals who are squeamish. I'm a patient as well as a health professional. I think I would be slightly squeamish about having maggots crawling around on my open wounds, and but I suppose the Rural Health Alliance would be an opportunity to talk to people in the communities, in their places of work, about the potential for this sort of therapy, make them aware that it's something that is actually mainstream, and that the practices aren't treating them with something out of the 16th century just because they have that particular bent.
And I suppose that widens it out further than the education to a certain degree. I think certainly I enjoyed your workshop this morning, and there was lots of I never know that sort of things, and I would have guessed that the practitioners, the nurses and the doctors out in the rural community need educating to stop us doing what we're doing wrong, really. I certainly know we touched on this morning, but for example the use of water, tap water in wounds, that's obviously just come up relatively recently. Would you tell us about that, the use of tap water in wounds?
Yeah, we used to use sterile saline, always in wounds, but there's been a lot of research done now to show that potable tap water, which means tap water that's fine to drink out of the tap, is absolutely fine to be using on wounds. Wounds are not sterile. When we're talking about, particularly when we're talking about chronic wounds, they're not sterile areas. So, and the other thing that happens when people are irrigating wounds and cleaning wounds is they just tend to clean the actual wound, and what's really important is cleaning the surrounding area, because there's a lot of bacteria on the surrounding area and we have to look after that skin as well. So by getting people into the shower is much better, or making sure that whole area including the wound is washed.
Good on you. Not actually talking of water, I think that's going to be a luxury which we won't be able to afford for much longer if the drought continues, won't it?
Yes, that's right.
That's what we're going for. Well, unfortunately, my voice is telling me that we're nearly out of time here, but I really appreciate both of you coming, and I'm sorry if I only had a very small snippet of what you were doing. But and Joe, likewise, thank you very much indeed for not only coming here, but all the work you're doing as well. I really appreciate that.
No, it's always a pleasure to talk to you, Buzz.
Bless you, even on camera. That's wonderful. Right. Well, we've got just a few seconds left, but certainly we'll be tuning in tomorrow. Now, tomorrow we've got Chai Chua, the National Director of the National Health Board. Joe Scott Jones, you're visiting us again because you've got nothing else to do, including not sleeping. And finally, we've got a snippet from the year's Nurses Forum with Deb Bailey and Sharon Hansen. So thank you very much indeed for tuning in. Thank you both very much indeed for coming. And enjoy the rest of the conference, won't you? And I'm looking forward to the social activities, which networking all about.